Antibody tests are commonly used to tell if someone is immune to diseases, and now it's being used to test for coronavirus. And we are joined by Dr. Murthy, infectious disease specialist at Cedars-Sinai. Thank you so much for joining us. We appreciate it.
Pleasure. Thank you.
All right, a question for you. How is an antibody test different from a COVID-19 diagnostic test?
Well, the antibody test actually is a measure of your body's response to an infection by developing antibodies, like an immunity check. And these antibodies develop a week to 10 days or more after the infection. So it's not a diagnostic test. It doesn't tell you that you're having the infection. Unlike the swab test, which actually is associated with the presence of virus particles in your upper airway when you're having symptoms, and that's a way to detect and confirm that you have the infection.
So, Dr. Murthy, what needs to happen to confirm that an antibody test for COVID-19 actually works?
Well, that's really $1 million question. Most of us want to know that answer to that question. And so the presence of antibodies in your blood is indicative that you may have been exposed to a virus or the infection in the recent past. What it doesn't tell us, however, is what level of antibody, or if any, protects you from subsequent infection. So it might partially protect you if you get re-exposed. It may fully protect you, and we don't know how long it's going to last.
So if someone tests positive for COVID-19 antibodies, will they be immune to the disease for life?
Well, that's the big question we don't know yet the answer to. We don't know the answer to that yet. There are obviously studies that need to be done, and science needs to be allowed to assess that. And one of the ways we're going to know that is by checking the antibody levels in the broad population, and then following them over time over the next 6 months or a year, perhaps, as we see more COVID-19 infections, whether those people who have the antibody detected actually are protected or don't get an infection compared to those who don't.
And
we don't know also.
Mm-hmm. Go ahead, I'm sorry.
I was just going to illustrate or compare what we don't know about COVID-19 is really keep in mind the potential of two different kinds of antibody responses. So we think about measles, for example. We know that somebody who's had measles may have lifelong immunity, whereas influenza is an infection for which we may have short-term immunity, but it doesn't last to the next year because both the virus might change and our bodies may not have long-lasting immunity, so we have to get revaccinated. So we don't know the answer to where COVID-19 fits in that spectrum of antibody response and protection and duration of protection.
That's an interesting point that you make. A final question for you, Dr. Murthy. What will it mean for society if many people test positive for COVID-19 antibodies?
Well, one of the key questions is understanding what the antibody tests actually signify. So it's going to depend on our understanding of the studies of prevalence in the community. And it might be different in different parts of the country or the world. So if indeed these tests are validated and we have broad numbers of people who are positive, it suggests that there may be some level of immunity and that there might have been broader level of low levels of infection that were undetected, because many people may have had a mild illness or even not recognized that they had symptoms. And it might have been what we call subclinical, or we didn't really have symptoms associated with it.
All right, Dr. Murthy, infectious disease specialist at Cedars-Sinai, thank you so much for joining us. You are always welcome on CBS2 News this morning. We appreciate it.
Thank you so much.
All right, have a good day.